Welcome to another episode of I Got This Anatomy Review. Urinary System. The urinary system consists of two kidneys, a right kidney and a left kidney. The right kidney a little bit lower than the left due to the fact that right above it is the liver, which is a very large organ, and it is going to be slightly lower than left. Now, the kidneys are being fed by the renal arteries, and the return line is the renal veins. The renal arteries are a large artery that comes off the abdominal aorta, one of our paired branches, and then the return line being the renal veins flowing back to the inferior vena cava. Now the kidney is an organ for elimination. It produces what we call urine, this biological waste product of the body. Now the kidney's primary job is one, yes, to eliminate waste, but another job is to fine-tune the composition of our blood, dealing with blood pressure and composition of our blood. Now, the outer part of the kidney is surrounded by what's called the renal capsule. It's a dense connective tissue, helps protect the kidney, as well as a lot of perirenal fat that helps kind of vacuum package that kidney in its posterior abdominal cavity wall. Now this is a retroperitoneal structure. That means the peritoneal cavity is towards its anterior. Now, the outer part of the kidney is known as the cortex, and the inner part is called the medullary. The cortex is where our nephrons are. We have millions of nephrons. These are the actual unit of filtration of the kidney. Towards the medullary region, where you're going to find the medullary renal pyramids. These are the clusters, looks like a little pyramid or a triangular shape in the medulla. That is where the collecting ducts are. That's going to flow to the collecting areas within the kidney to reach the renal pelvis. Now here's the order of basically the filtrate formation. The capillary regions that are actually being filtered are filtered out what's called the glomerulus. Now the glomerulus is this capillary network within the renal corpuscle, or glomerular corpuscle, sometimes referred to as Bowman's capsule. Well, there's also what's called a portal system here, because between the glomerulus and the peritubular capillaries, you basically have another series of vessels between two capillary beds. And then on the other side, the venous return back towards the heart. Now this area that, the area that we have the glomerulus filtering, making that filtrate, flows into what's called the proximal convoluted tubule. Now the proximal convoluted tubule is then going then flow to one of our nephron loops, the thinner descending loop of Henle, and then it's going to flow up the larger ascending loop of Henle. That's just another eponym that it's known by, the nephron loop, descending and ascending. Now that ascending loop or nephron loop, or loop of Henle, flows into what's called the distal convoluted tubule. And from the distal convoluted tubule, it will then flow into what is known as the cortical collecting duct, and it will flow down into the medullary collecting duct, ending in what's known as the papillary duct. Now the papillary duct, papilla meaning nipple-shaped duct structures, this is going to actually empty into those collecting areas known as minor calyx, C-A-L-Y-X, meaning little funnels. These minor calyx will join together and empty into a larger funnel system known as the major calyx. There are multiple different major calyx that empty into the renal pelvis. Now, pelvis meaning basin. That's basically what pelvis means, a basin. So this basin of the kidney, which is called renal pelvis, will then flow out of the kidney into what is known as the ureter. Now, I like to say ureter because it has two E's, letter E in it, to help us remember that we have two of them, just like two kidneys, a right and a left. So we have a right kidney with a right ureter, and a left kidney that has a left ureter. So right and left, kidneys, right and left ureters. Now these propel, they're little muscular tubes, very small, but it creates a peristaltic movement. That means urine can actually flow upside down if you're standing on your head, not just limited to gravity. So it actually will flow from kidney to the urinary bladder. Now inside the urinary bladder, this is basically our reservoir collecting urine and holding that urine until we can eliminate it. Now, very similarly, there are folds just like the kidney, and what these folds are known as rugae. So we call them urinary bladder rugae. So when that bladder fills up, it stretches out, and when it eliminates, they contract, and there's going to be more folds. Now the epithelium of the urinary bladder is actually a transitional epithelium because it's allowed to change shape due to the stretching, or when it's full, or when it's eliminated at contraction. So there's extra smooth muscle and elastin fibers to help accommodate the change. So we have the cells at this level creating those tissues, that transitional epithelium, that support that. There are these two openings, the ureteral openings. There are two of them that come in at the top of this other area. It creates this triangular region, little triangle shape, little triangle. So make it like that, triangular shape. So at the top is where the ureters enter, and towards the bottom of this region is where the outflow, or urethra, is. This is called the trigone of the urinary bladder. Now, the outflow goes into what is known as the urethra, and it has a TH in it, and I like to remember it this way. There's one E in urethra, and I think of it like dyslexic the, T-H-E, but it's actually going to have a E-T-H, urethra, within it. But anyway, this is what is going to eliminate the urine to the outside. That is just a kind of a quick overview of the kidneys. Now the kidneys on the inside, that is basically creating the filtrate and eliminating it to the outside. There's a little more detail on some of the internal vessels. It's a little harder to describe that with just words, so you want to look at the picture showing you basically your renal arteries branching into the segmental arteries inside the kidney, into the interlobar, flowing up into the arcuate artery that goes basically around those individual segments of the renal pyramids, and then of course cortical radiate arteries that feed up towards the afferent arterioles, which are going to feed into the glomerulus. The efferent arteriole is what comes out and feeds into the peritubular capillaries before it goes back to the whole venous return. Basically the same names, but venous return in reverse towards the renal veins. Well, that kind of concludes this episode of Urinary System. So this episode was brought to you by SheerImpact.com.